Let's discuss some of the important signs that can be seen in case of diabetic retinopathy. So first and the most important sign is microaneurysm. These are the first that can be seen in the case of diabetic retinopathy. Okay, they appear as small red dots near the capillary non-perfusion areas. You can see these small red dots. As you can see in this pic, also these small red dots. Normally their size doesn't change. But there's one important thing, that is how can we differentiate between microaneurysm and hemorrhages. Normally the size of range of microaneurysm is between 12 to 100. If they are greater than 100 micrometer, then they are known as hemorrhages. Now the second thing, these are retinal hemorrhages. As we have discussed earlier, their range is like around about 125 micrometer. Okay, they are classified into two. First one is superficial hemorrhages and other is deep. So in the case of superficial hemorrhage, they are present in the nerve fiber layer. You can see in this picture, these are the nerve fiber and this is the superficial hemorrhage. So they are mainly arterioidal in nature, okay, and their appearance is feathery or flame shaped. You can see because of this arrangement of nerve fiber, they are feathery in appearance, and blood is confined to little triangular organization. Okay, other is deep hemorrhage. They are present between outer plexiform and inner nuclear layer. They appear as blood shaped, and the other thing is their origin is venous in origin. Venous. Okay, they are compact between the middle layer, as you can see this. So they will keep on going and they will form this round one, not this. They are feathery in shape. You can see in this picture also. These are blood hemorrhages, and these are long feathery like superficial flame hemorrhages. The other sign is cotton wool spots. So this is a sign of ischemia. So what happens in cotton wool spots when the normal blood supply to the nerves is blocked? Now what happens? There is the accumulation of the stock of the flow and stasis of the exoplasm. So this exoplasm will appear as the form of cotton wool spots. So initially they are white fluffy patches, and the other important thing about them is they do not have distinct margins, and they are present near the nerve region. So they can be seen mostly around the posterior pole where the nerve is present, because they are based on the nerve exoplasm flow stasis. The other sign are hard exudates. Now what are hard exudates? These are yellowish, well circumcised, so they have proper margins, and they occur mainly typically due to the deep to the retinal vessels and outer plexiform layer. So these are actually the leakage of the vessels. So these deposit at the form of lipids and lipoproteins. Okay, and the other thing is if the leakage occur near the macular region, so it will lead to formation of macular predation. So what is macular predilection? It is the change of the shape of the macula. Normally in the case of the hard exudate, there is a leakage of the material from the vessels. So this leakage material can accumulate in the macula, as you can see in this peak in OCT. So this is form of cyst formation of macula. This is actually the exudate, and these are the hard exudates. As you can see, these are proper margin and yellowish in shape. Now there is a confusing thing, that is this hard exudate can be confused with the cotton wool spots. So as you can see these two peaks, if you compare both of these peaks, this one is the hard exudate, these are cotton wool spots. As you can see in the case of cotton wool spots, these are fluffy and they do not have distinct margins. In case of these have proper distinct margin and they are more yellowish. The other important sign is venous beading or venous looping. Now what happens, as we have studied in the case of diabetic retinopathy, in its pathogenesis, the vessels become more basal membrane become more thick and their structure become more fragile. So the beading occur if this is a normal vessel because of the fragility of the vessel wall due to the accumulation of glucose. This beading like appearance occur, and the looping may occur, as you can see in this picture. Looping occur. Both of these reflect increase in the extensive retinal ischemia. The other thing is IRMA. What is IRMA? The IRMA stands for interarterial microvascular abnormalities. And the other thing is new vascularization. Both of these occur mainly due to the ischemia and hypoxia. But what is the main difference between these two terms? Let's discuss this. So what is IRMA? So these are the shunt vessels that are abnormally branching. So whenever the supply of the blood of the retinal vessel are blocked, now our body will try to compensate the blood supply to the vital organ. So there is abnormal shunting vessels that are produced from the normal vessel. And prior to this, there is the blockage. So these normal shunt vessels will try to supply the blood. So they are within the retina and often on the border of non-perfused retina. Okay. While in the case of new vascularization, these are new blood vessels. They are not derived from the previous, they are not the shunts, they are new vessels. Okay, they start on the surface of retina and optic nerve head, breaking through the internal limiting membrane. Okay, the main thing that differentiate between IRMA and new vascularization is that in case of IRMA, the vessel do not leak, they are normal, probably more normal in nature as their thickness is normal. While in case of new vascularization vessel, they are more leaky and they have immature vessel walls. Okay, one of the main reasons for the production of new vascularization is VEGF, while in case of IRMA, is occur mainly due to less directly linked to the pro-angiogenic factor. This mainly occur due to the ischemia or due to stoppage of the blood supply. The other two most important signs are diabetic macular edema. So diabetic macular edema is actually the accumulation of the fluid in the inner and outer plexiform layer. Okay, it can occur at any level in the case of diabetic retinopathy. The other term is diabetic papillopathy. What is it? It is a rare acute complication characterized by the optic disc swelling and edema. It may occur at the level of optic disc and it affects the optic nerve head and it causes visual problems.